Hello, I'm Dr. Ken Landau. Thanks for joining us. Let's talk about Xiidra. Xiidra is the first new therapy for dry eye syndrome that was approved in the past 13 years. Actually, just received its approval in July of 2016. It's a medicine that contains a drug known as lifitegrast. Lifitegrast is an LFA1 antagonist. That means it interferes with the immune system on the surface of the eye, and that seems to be the cause of the dry eye syndrome. Now, dry eye syndrome is a very common disorder. It affects somewhere around 1 in 20 people between the ages of 30 and 40, and that number increases to about 10 to 15% of senior citizens. Dry eye syndrome is a condition where either one, the eye doesn't produce enough of the aqueous or watery tear, or two, the tears are of the wrong consistency. So if the lacrimal glands don't work, you can't produce enough of the tear itself. But if the meibomian gland that makes the fatty substance isn't really producing the fatty substance correctly or in enough quantity, then the tears are just going to evaporate into the air. Well, the condition affects somewhere between about 16 and 30 million people in the United States, with women being more affected than men, but only about 1 million of the people are on treatment. When you have the dry eye syndrome, you have difficulty using your eyes, you have difficulty reading for long periods of time, maybe you have poor tolerance of a dry environment like you might get on an airplane or an air-conditioned environment, or just in the desert. Symptoms are relatively non-specific, some stinging or burning or a gritty feeling in your eye, or pain or redness or blurred vision, or a stringy discharge or heavy eyelids or eye fatigue or difficulty using your contact lenses. But what really takes people to the eye doctor are symptoms of chronic eye discomfort or just dryness or irritation, or some problem with the quality of life involving your eyes. Now, the therapy for the dry eye syndrome or dry eye disease has really not changed much over the past 50 years. Topical lubricants are used, or artificial tears can be used as often as once an hour, although most people use them 5 or 6 times a day. But if you're going to use them more than 4 times a day, you should use them without preservatives. Ocular plugs can be used, punctal plugs can be used. Everyone knows about Restasis, that's also advertised very frequently, and topical corticosteroids can be used. It's simple to use Xiidra. You put 1 drop in each eye twice a day. You use 1 container in the morning, 1 container in the night. Each contains a little bit more than 2 drops, but throw the container away once you've used it. What we know is you don't want to touch the packaging to your eye. Obviously, that seems to be should go without saying. If you wear contact lenses, then you should take them out and keep them out for at least 15 minutes after you use the medicine. But remember, contact lenses can cause dry eye syndrome. We know that the side effects are relatively mild. They're transient. Maybe you get a little irritation or discomfort, and maybe you have some decreased acuity for a short period of time. But interestingly, some people just get a bad taste in their mouth after they put the drop in the eye. Unusually, you might get some headache or increased tearing or some eye discharge or some redness, but that's not usually the case. Obviously, there haven't been a lot of studies since it's a brand new drug in pregnancy, but it doesn't appear to affect fertility or breastfeeding or carcinogenesis. We know that if the tears become abnormal for any reason, well, then the eye surface becomes inflamed. And when it becomes inflamed, then you don't make the tears. So this medicine, lifitegrast or Xiidra, seems to interfere with that whole scenario. So that's good. Well, it was tested in a variety of people. Average age was about 60. It was a study that excluded people who were using Restasis or steroids or other kind of eye drops, using or having had a LASIK procedure within the past year. And these people seem to do relatively well. Now, they start seeing the improvement within about 14 days, and they see the maximum improvement within about 12 weeks. That's much more rapid than with Restasis. Now, we can talk about something known as an eye dryness score, a score that goes between 0 and 100. 100 is the worst. Most people average around 40 to 70 on the scale. Well, after 12 weeks of using the drug, it seemed that there was about a 4 to a 12-point improvement better than the placebo. Well, it really isn't all that impressive, frankly. The placebo patients improved on the scale somewhere between 10 and 30 points. The people using the Xiidra improved on the scale somewhere between 15 and 35 points. So a little bit better, but nothing really dramatic, and you still have to use some of the artificial tears. Now, the medicine gained some degree of fame with Jennifer Aniston. She said in an interview, unrelated to the drug, when asked if she was addicted to anything, she said, yes, one thing, and that was eye drops. Well, the company heard the interview. They got in touch with her and said, hey, why don't you go see the eye doctor, because you might actually have dry eye syndrome. She did go to see the eye doctor. He said, yes, indeed, you do have dry eye syndrome. She was hired as a spokesperson, and now there's this campaign called I Love. I Love, U-I-E-L-O-V-E. And it doesn't have anything to do specifically with the drug itself, but it's just sort of something to make you aware of dry eye syndrome. Well, they also have some other advertising that's going on, heavy, heavy, heavy duty on digital and print, on social media, in office, lots of things. Well, who should prescribe it and who should use it? Well, you should have at least moderate to severe dry eye syndrome. You should need at least 3 times daily application of artificial tears or some of the other substances that are used. You should have maybe some inflammation on the surface of your eye, and it's probably best if it's prescribed by an eye doctor, an optometrist, or maybe even a rheumatologist. Now, in the old days, last year, the year before, if you had dry eye syndrome and you were going to get a prescription, chances are you were going to get Restasis. They had 100% of the new prescriptions, but now they only have slightly in excess of 50% of the new prescriptions. 1, because it's a pain in the neck to use, and 2, because it causes a lot of side effects and takes forever to work. Now, unfortunately, both Xiidra and Restasis cost about the same, a ridiculous cost. If you pay cash, it's in excess of $500 a month, and if you have insurance, and you go through some place like GoodRx, well, the price is still going to be quite substantial. They have another place called blinkhealth.com, and with the doctor's prescription, you can get the drug probably for about half price. Consumer Reports evaluated the medicines, Xiidra, and they say, well, it's safe, and at least it's modestly effective. What's my rating on the drug? Effectiveness, so-so, nothing great. We still have a long way to go. Cost, my rating on the cost? Ridiculously high. Anyway, thanks for watching. I'm Dr. Ken Landau.